What is the dental implant process from start to finish? Patients often ask me what the dental implant process actually involves, so I'll talk you through it briefly. Implant treatment is a staged process. It isn't rushed, and that's deliberate. The first stage is assessment and planning. We examine your mouth, review your medical history, we take some scans. There's going to be 3D intraoral scans, which are like 3D pictures of your teeth. There's going to be 3D scans of the bone called a CBCT scan or a cone beam CT scan. And this all allows us to plan treatment carefully before anything begins. The next stage, once a patient is happy and the consent has been signed and we've been through all the pros and cons and risks and benefits of the process, is to place the implant itself. This is done under local anaesthetic and is very planned, very calm, very predictable procedure. Okay, there is nothing to be worried about. It's not painful. I can't stress that enough. It is not painful. We use microsurgical techniques as well while we're doing it. Okay, working under magnification with very fine instruments and small sutures. This allows us to be precise, minimise trauma to the tissues, which in turn supports better healing. The vast majority of patients, hand on heart, come back for the suture removal appointment and tell me that they're so surprised at how straightforward and how little discomfort they were in after the procedure and during the procedure. Okay. After the implant's placed, we then need a healing period. That's typically between 3 and 6 months. Usually 3 months, but sometimes for patients who have medical compromises, diabetes, that kind of thing, or if it's in very heavily grafted bone, we might err on the side of 6 months. But during that period, the bone actually has to grow into the implant surface itself and bond to the bone. Like a hip implant, which is also made of titanium, the bone's got to grow onto the implant surface for it to be successful and for it to integrate. In many cases, you won't be left without a tooth during that time. There are options. We can do a bonded bridge. We can do a temporary denture. If you're happy with the gap, that's absolutely fine. You can keep the gap while it's healing. After that 3 to 6 months healing period, we then put a special post in the implant. We call that a scan body. Take a 3D scan of the post and the teeth. Take some photographs and send all that information by email off to the lab, and the lab technicians will sit there, get the information, and then they'll make the crown or the bridge or whatever we're making for you. And about 2-3 weeks later, we'll have something in clinic to fit for you. And then we'll check the function, the bite, the appearance, cleansability, everything like that for you, and just make sure that everything is optimized for a really good long-term result for you. At the end of treatment, we'll often ask you to come back every 12 months for an implant review. This means that we can check the health of the tissues around the implant, which is the gum and the bone, make sure that you're able to clean it properly and that everything is working really, really well for you, and that we can be more confident that things are going to last in the long term for you.